Hi, I'm Lee, and I'm doing my presentation on eating disorders. So, what are they? Um, there are severe disruptions in eating behavior and significantly impairs health and psychosocial functioning. So, there are many types of eating disorders. I'm focusing on only two, so that's anorexia and bulimia. Typically, they're preoccupied with thoughts and emotions about food, weight, and shape disproportionately influence self-concept, and there is a fear of weight gain. So for bulimia, recurrent cycles of binge eating followed by inappropriate compensatory measurements. So that it can include purging, diuretics, laxatives, or fasting. Purging is the most common ways though. So signs and symptoms, frequent trips to the bathroom, calluses on the back of hands and knuckles, that's from purging, excessive exercise. So over here, there's the chart or this diagram of all the health consequences from bulimia. So swollen salivary glands, inflammation of the esophagus, rupture in the wall from purging, abnormal heart rhythm, gastric reflux, peptic ulcers, constipation, dehydration, and hypokalemia. So for anorexia, it's a little bit different. It involves starvation, severe weight loss, or lack of weight gain in children through restriction of calorie intake. So 15% are below expected weight. Signs and symptoms, amenorrhea, which is loss of menstruation, withdrawal from friends and activities, and food rituals, which means maybe like cutting your food up into small pieces. So anorexia affects the brain. It also affects the brain in bulimia as well. So changes in brain chemistry, bad memory, hair becomes thin and brittle, skin becomes yellow and dry. You can get acute kidney failure, muscle aches, pains, paralysis, constipation, and bloating. And also osteoporosis is a big one because of such a low weight level. So lifetime prevalence of eating disorders is way more common in women than men. You can see that from this graph. For anorexia, bulimia, and binge eating disorder, that's one of the other disorders. And it affects at least 30 million people in the US in a lifetime. So it is most prevalent in Western cultures where values of beauty and thinness are emphasized. The onset is typically adolescents, mostly white females and upper to middle class families. So 70% of healthy weighted women want to be thinner. So why are so many people dissatisfied with their bodies? And that is mainly because of cultural influence. So over here you see Barbie, and estimates say if she was life size, she would be 5'9" and 110 pounds, which is just not realistic or ideal. She would look very unhealthy in real life, but we are portraying this in like movies and TV. And then over on the other side, Kim Kardashian, who is advertising for a lollipop that's supposed to suppress your appetite. And this is an example of false body image. And it glamorizes the thin ideal as well. And it's not realistic, and it doesn't work. So what also contributes to cultural influence is genetics, interpersonal, psychological, and social reasons. So 58 to 76% may be related to genetics. So there could be unbalanced chemicals in the brain involving leptin and ghrelin. And if you have a relative with an eating disorder, you're 7 to 20 times more likely to develop one yourself. Low self-esteem, perfectionism, other comorbidities such as OCD, anxiety, maybe depression, can also be related to eating disorders. Bullying about weight, trauma can also cause eating disorders or contribute to it. Athletes and dancers are more susceptible to eating disorders, and also, like I said before, cultural influences, valuing that thin ideal, and it can be through mainly social media nowadays. So the eating disorder cycle, you have your vulnerabilities that like your athletes, being a perfectionist, things like that, along with triggers So that could be anything that lowers self-esteem, changes in life, so maybe going to college for the first time, or other trauma can lead to coping with food, and just unhealthy coping skills, restriction, and that eventually can lead to symptoms of eating disorders, which leads to the eating disorder itself. And then it's just a nasty cycle of feeling guilt, shame, anxiety over eating and food intake. So treatment, there's many treatments: cognitive behavioral therapy, medications, dietary therapy. It may require hospitalization, especially in anorexia, who are just too low of a weight. So, but only 33.8% with anorexia and 43.2% with bulimia seek treatment. And there's only a little bit of research in exercise as a treatment to eating disorders. So that's what we'll look into. So for pharmacology, antidepressants are shown to be effective to reduce purging and binging in bulimia. So some effects of that, though: exercise affects dizziness, rapid heart rate, insomnia, headaches, joint and muscle pains. And anorexia medications aren't proven to be much effective, but psychotropic medications may prevent relapse in eating disorder symptoms. Exercise effect on that: it may prolong QT interval, which can result in ventricular arrhythmia or sudden death. Also, drowsiness, fatigue, and disinterest in activities are side effects. So 50 to 80% of individuals with eating disorders engage in excessive exercise as a way to compensate for the weight gain. So stress fractures are common, especially in people with anorexia, because they're more prone to osteoporosis. Abnormal potassium levels are common in people with bulimia. It can induce heart arrhythmia resulting in death. Obviously, overuse in injuries to muscles, ligaments, and tendons. Exercising underweight, this is mainly for people with anorexia. You get hormonal dysfunction. It causes cessation in menstruation, reduction in bone density, high blood glucose, and cholesterol levels. Hypoglycemia is exacerbated from the exercise, and it can result in irreversible brain damage or death, and that's due to unstable blood glucose levels. Long-term effects: bone and health and body composition are adversely affected through exercise. So basically, the exercise response is the opposite of what would happen in a normal, healthy individual. So therefore, all nutritional needs must be met in order to begin an exercise. So physical benefits of exercise: bone loading exercises can reverse bone density loss. With adequate estrogen or testosterone levels, it may increase BMI and improve body composition. A study has shown significant increase in muscular performance after an 8-week training program in patients with anorexia. So you see on these charts here, from pre to post exercise, it has increased in leg press, bench press, and lateral row. And then DET, that just means C training, so obviously it's going to decrease after exercise. So exercise also improves blood glucose levels, insulin sensitivity, thermogenesis regulation, and increases in basal metabolic rate. So mental health benefits: reduce drive for thinness, bulimia symptoms, decrease body dissatisfaction, reverse cardiac abnormalities in severe anorexia patients, and improve overall quality of life. Studies have shown that including mindfulness exercises, so that can be like yoga or Tai Chi, is beneficial and can improve overall quality of life and improve eating disorder pathology without compromising weight restoration. So this chart, or this table over here, shows this study in yoga for people with eating disorder symptoms. So for my case study, Emily is 21 years old, female, BMI 21, blood pressure 112/60. She's a non-smoker, heart rate is 70 beats per minute, total cholesterol is 195, and she has a high cholesterol, probably because in people with anorexia, they have high cholesterol levels due to the weight loss. So Emily has been out of recovery for anorexia for 8 months. She's consuming the right nutritional needs and wants to incorporate exercise in her life again. Her goal is to be able to participate in skiing. So it's good that she has her nutritional needs, or otherwise she wouldn't be able to engage in exercise. So exercise testing is not recommended because it could trigger excessive exercise behavior and eating disorder symptoms. So screening for exercise-related pathology is a good alternative and can help identify psychological variables present that are associated with exercise. And a recent study has shown correlation between reduced exercise pathology scores and a reduction in eating disorder symptoms. And you see that in this chart, or this table, that shows that correlation from that study. So exercise prescription, there are no official guidelines for this, but a study shows a systematic review and a proposal of guidelines for the eating disorder treatment. So they came up with these themes in therapeutic exercise for eating disorders. So adopt a team approach, continuously monitor medical status, screen for exercise-related psychopathology, create a written contract, include psychoeducational component, focus on positive reinforcement, create a graded program, start with mild and build to slow intensity, tailor the mode of exercise to the needs of the individual, include nutritional component to account for this physiological needs during exercise, and a debrief after the exercise session. So cardiovascular endurance, 2 to 3 days a week, 30 to 39% of heart rate reserve, 30 minutes a day. Nature, walk, or swimming would be ideal. So slow-paced aerobic exercise is necessary at first to let her listen to her body, understand the physiological responses to the exercise, and a slow progression is needed to be safe. So resistance training, 2 to 3 days a week, 8 RM to 12 RM, 2 to 3 sets per muscle group for 30 minutes. Types of these exercises is body weight exercises or using elastic tubes, dumbbells, kettlebells. So resistance training will improve her bone density and muscular strength, so that's important because she is prone to osteoporosis, and it will allow her to engage in skiing again without risk of stress fracture. For flexibility, 2 to 3 days a week, 10 to 30 second stretch to the point of slight discomfort, 2 to 4 sets of accumulating 60 seconds per stretch. I suggested yoga, static, dynamic stretching. Again, yoga will improve eating disorder symptoms, and stretching increases range of motion, improve mobility and posture. So overall, it will all improve her quality of life. So in accommodations and considerations, debriefing should be incorporated during and after exercise session. Include emotions and thoughts and sensations evoked by exercising to assess the psychological and physical aspects of exercise. Technology to track exercise could trigger excessive behavior, so it's important not to use technology to track your steps or something like that. Avoid high-impact sports until bone health improves. Exercising in groups is recommended, so you're not doing it alone, so it doesn't become compulsive. Address deficiencies due to increased risk of cardiac complications and death before consideration of exercise. So in conclusion, eating disorders have the highest mortality rate of any mental illness. Suicide is one of the main causes of death in these eating disorder symptoms. So what can we do about it? Support local national eating disorder organizations. One of them is NEDA. So that's one of them. that you can donate to. Encourage people to strive for health instead of weight, and appreciate everything that your body does for you. And those are my references. Thank you.